Welcome everyone to the Connecting Kids to Coverage National Campaign webinar, connecting students to coverage this back to school season. My name is Jason Worden, and I work closely with CMS and the Connecting Kids to Coverage National Campaign to support the enrollment of more children and their families in free and low-cost healthcare coverage through Medicaid and CHIP. Back to school season is a crucial time to engage families in conversations about getting their children healthcare coverage. Organizations across the nation have partnered with schools to connect and enroll eligible students in Medicaid and the Children's Health Insurance Program, also known as CHIP. Children who have health insurance are better prepared to learn in school, and they are less likely to miss school because they're sick. As the current school year winds down and a new one begins, many organizations are starting to plan ways to integrate health insurance enrollment efforts into back-to-school and year-round activities, including increasing communication with school-based health centers and extracurricular programs. Our webinar today will share best practices for outreach and enrollment during back-to-school season and tips on how to start your planning and engage partners in school staff to maximize your success. Now, today we'll hear from a select panel of speakers. After each of our speakers, we'll provide a poll question for your review and response. Please note that you will receive a prompt on screen to respond to those polls as we move forward. In the event that you cannot access them in real time, we will also be sharing this after today's webinar, and we'll be able to accept answers via email or any additional information you'd like to share. With that, I'd now like to introduce Amy Lutsky, Director of Division of State Coverage Programs at the Centers for Medicare and Medicaid Services, who will kick us off this afternoon as we begin today's webinar. Amy?
Thank you so much, Jason. Hello, everyone. This is Amy Lutsky. As Jason mentioned, I direct DSCIP, the Division of State Coverage Programs, and we are in the Centers for Medicaid and CHIP Services here at CMS. CMCS and the Office of Communications actually jointly administer the Connecting Kids to Coverage program. So I just wanted to start off with that because CMS sure is a big place. So just wanted to explain that. I did want to start off by saying that this is a special time for the national campaign. After a lapse in CHIP funding and some nail-biting months in 2017, in January, the Healthy Kids Act extended CHIP for 6 years, and in February, the Access Act extended it for another 4 years. And both of these pieces of legislation funded the Connecting Kids to Coverage initiative, including the national campaign. And I think that is a real testament to what folks on this call already know, and that is children's coverage matters. We are thrilled to have so many of you today joining us on this call because Back to School, as Jason mentioned, is a fundamental outreach and enrollment initiative for getting uninsured children enrolled in Medicaid and CHIP. Well, the kids right now are counting down the days until school lets out, and I have 2 teen boys, and I will tell you they are counting it down in hours at this point. It really is prime time for us to start planning ahead for next year's 2018-2019 back-to-school season. We know that health coverage and access to care are critical to ensuring that children are healthy and ready to learn. And we know that uninsured children struggle to get preventive care, and this negatively impacts their academic achievement. So it's very important for us to focus on how effectively we can identify these children and get them enrolled in Medicaid and CHIP. School-based outreach and enrollment efforts are important because they work. You'll hear from a few of our Connecting Kids to Coverage grantees today and guest speakers that have employed some very successful strategies. And I'll just mention, if you are someone who is looking for some evidence-based research that supports back-to-school initiatives, there was a wonderful January 2018 article in the Journal of School Health that showed a 12% increase in enrollment rates in Medicaid and CHIP using a school-based public health insurance outreach program for kindergartners in North Carolina. And it made me and Kathy Cope here especially proud since they were a former Connecting Kids to Coverage grantee. So, without further ado, we will first hear from Evelyn Mercado, the Community Programs Manager of HOPE. Evelyn will discuss how her organization engages families in the care and development of their children. Next, Jody Ray, Instructor Program Director of Florida Covering Kids and Families, will walk us through their grassroots approach to establish sustainable enrollment and retention in children's health care. Then, Rebecca, Project Director of Children's Programs at AASA, the School Superintendents Association, will guide us through their school-based approach to children's health coverage. We will then hear from Laura Cavello, who also works closely with the Connecting Kids to Coverage National Campaign, and she will highlight the campaign's school-based outreach and enrollment toolkit. And then we will share the variety of back-to-school resources that are available on InsureKidsNow.gov. Finally, we will wrap up the webinar by addressing your questions. So please, as Jason mentioned, use your chat box throughout the webinar to submit your questions to our speakers. And now I'm happy to introduce our first speaker, Evelyn Mercado from the Community Programs Manager of HOPE. Evelyn?
Hello, good afternoon, everyone. Thank you for having me. I am from HOPE's CAP Inc. We are a nonprofit community action agency who has been in existence for over 53 years, and we primarily serve low-income families and individuals. The mission of HOPE is to provide services that respond to the social and educational and training needs of individuals in an effort to overcome barriers and fight the causes of poverty. HOPE assists every year with empowering families of all ages, more than 1,000 children from birth to 5 years old for school readiness, and over 3,000 youth, adults, and seniors towards economic self-sufficiency. The way we try to connect students to coverage is in a few variety of ways. One of the main things that we decided to do was partner with uniform stores in school districts requiring them, and that came about because when we were writing the grant, I personally, as a parent, had to always go purchase uniforms for my children. And I don't know about any of you, but uniform stores are always packed. Everything takes so long. And then that's when the idea came about, and we said, hey, why not bring staff on board to try to sign up families for health insurances and services that they may need. So we started doing the partnership with uniform stores, and that became so successful. So what we've done is not only do we have our staff go there and help with enrollment, but we offer a little incentive to the families that do sign up. Like sometimes we'll give them $5 Dunkin' Donuts gift cards and stuff like that. Another partner of ours is supply stores. It's really important during that time of year to be at supply stores like Walmart and Target, etc., because and Staples, of course, because families are always in there struggling to get the supplies that they need for the new year. It's really important that you become active with Parents' Night and all back-to-school events in all communities that you're serving. Also, very important to partner with local recreation departments. And most importantly, partner with the Board of Education in all districts. Another good thing that we at HOPE decided to do is sponsor a lot of back-to-school events, like with giveaway items such as free book bags, pencils, and different supplies that the families that we serve may need, and then also enroll at that moment. Some of the strategies that we do for community outreach is partner with the Board of Social Services to promote the work. It makes it easier for them, and they love you for it. Bilingual staff, if you have the opportunity to hire bilingual staff to continue and participating in health events and other social service events throughout the districts is something that you could do. That's what we do, and having bilingual staff on board has been very, very helpful. And then also conduct like 3 events during the summer to try to enroll people. That's especially important because during the summer, people don't want to think about school, but it's right around the corner, so you got to keep them engaged and help them with enrollment. Some tips that and best practices that I can offer are, like I said, hire bilingual staff to conduct outreach and enrollment according to the need of the community. Have your staff travel with laptops, portable printers, and Wi-Fi to off-site locations. This is something that we adopted from the VITA model. If any of you know about the Volunteer Income Tax Assistance Program, That's something that they require, so we adopted that same model and it made it easier. Another thing is always follow up with families after 2 weeks and continuously thereafter to ensure that they're not only happy, but that if they received anything in the mail, they bring it to you and you help them. And then always assure the families that you're working with that you're their advocate. You're there to support them and help them through the whole process. Makes them feel comfortable and makes them trust you, and it just makes their lives easier. Partnerships. We believe that it's really key for growth for you to have partners such as, like we do, the Board of Education, the Board of Social Services, local public housing authorities, because that's where a lot of the majority of your low-income families live, Division of Child Protection and Permanency, formerly known as DICES. Also, all county offices, any office that you could think of in the county that deals with family, even if it's like the Division of Aging, partner with them, because sometimes grandparents have children that they're being guardians to, and they could use this assistance. But mostly, I think it's really important for you to partner with your legislators. Bring the political figures in, because they're going to be your biggest advocate. They help you by bringing families in that they know, because, you know, their constituents are going to come to them, and they're going to have you as that partner to help them with the services that you offer. So that has been something that we feel has been strong with growing our CHIP program and making sure that we serve many, many families. So I would encourage you all to have partnerships such as these. Resources that I could offer you and tools is our website. We have a wonderful website. It's always getting revamped, which is www.hopes.org, youth services. I can be reached at 1-855-OK-HOPES. It's a really easy phone number, 1-855-OK-HOPES, and my extension is 1302. Or via email, emercado@hopes.org. I thank you very much for having me on this webinar. And if I have any questions that I could assist you with, please let me know. Thank you very much.
Thank you very much, Evelyn. We appreciate your time this afternoon. We'd now like to share a poll question with the group. Our first poll question today: what type of outreach and enrollment activities has your organization found successful for back-to-school season? We have a variety of options here to share with you, which you can respond to on your screen in front of you, whether it be school information nights, backpack drives, immunization clinics, possibly adding information to school registration forms. Or if you still have not identified exactly how you are going to engage these activities, perhaps what you're thinking of doing in the future. Thank you very much for your responses. We're excited to certainly hear from what you are doing, both past, current, and in the future for all of your back-to-school efforts, and what your plans are to engage eligible children and their families in your communities. We now like to introduce our next speaker, Jody Ray. Jody is the Instructor Program Director for the Florida Covering Kids and Families Program. Jody.
Hi, thank you. Yes, I am with Florida Covering Kids and Families at the University of South Florida. We are a statewide entity that focuses on connecting individuals to health coverage, and our history goes back to, around not long after CHIP first passed, and we were part of the initial Covering Kids initiative from the Robert Wood Johnson Foundation. We also work very collaboratively with a statewide coalition of individuals and stakeholders around the state that are very focused on those issues around connecting kids to coverage. The things that we focus on, and we have been focusing on now for about 20 years, are providing enrollment and retention assistance. So we've got partners that we train around the state. We've got participants in the projects like the MACRA grant that are providing enrollment and retention assistance, helping people stay in the program and navigate the enrollment process. We focus on making sure that there are individuals out there in the communities, making sure that they're providing that access to the application process and also the informational materials for the Florida Kid Care Program, which is our CHIP and Medicaid program. We reach out to both the families and consumer partners, businesses. We work with those serving the military and veteran community, anyone that's really got a connection to people. We work with anywhere people live, live, work, play, whatever they're doing. So we make that connection. We work very hard to develop and expand on business partnerships. We also work with partnering with the media resources. Having those media partnerships has been really valuable. When you have limited resources, those partnerships are great at helping us get information out about the enrollment assistance, about the program, about the events where the assisters are going to be, especially during back to school. This gets pretty heightened. We focus on working with collaborative initiatives in different communities, and we provide training and resources to coalitions so that they can focus on reducing uninsured kids in their communities in a very targeted way, identifying who their specific populations are, and strategically looking at how do they address this issue in their local communities, as well as working again with the state coalition, which helps us to expand our reach, and that includes the membership of our state Medicaid and CHIP office, as well as the eligibility folks. And we have schools, we have community health centers, we have a wide range of stakeholders who are engaged in reducing uninsured kids in Florida. Next, please. So, Florida is typically ranked pretty high among states for our uninsured number, but we've seen significant declines in our uninsured rate, which we're very proud of. We still have a pretty solid number out there of kids that we need to find, particularly considering most of those could be eligible for CHIP and Medicaid. Those numbers obviously nationally keep going down in terms of the uninsured, and as well as those that are now gaining access to coverage. Next, please. So for back to school, this is like I call it our tech season, because this is when everybody's working way overtime. This is the time where we've got events every weekend. We look at back to school season. It's a little bit bigger. We actually start some of this work in June. The pre-planning starts in May, and we start seeing events going on in June. It gets pretty heightened in July and August and September. But it does go on in Florida well into October, because, schedules being what they are, and some districts like to wait until after the kids are actually back in school to hold some of their events. This is just, we have several different ways that we track the activities that are going around the state. One of our responsibilities is to connect partners to events that are going on in different parts of the state, and make sure they have the resources to get out there and promote the CHIP and Medicaid program, our Florida Kid Care program, and make sure they're trained to provide that enrollment assistance or those referrals. And then we track how many events are going on out there where this is going on. And so we do this each week for our state Kid Care partners, which include Department of Health, the Medicaid, CHIP, and we actually have 4 partners that are involved in our Kid Care program. That include our Children's Medical Services, our Medicaid program, our Florida Healthy Kids program, and our MediKids program. And so we work for them. We try to coordinate partners that are going out to all these events. Next, please. So these are just snapshots of some of the things that occurred last year, but we break it down a couple of different ways. Like I said, we break it down by week. We look at county level data, but we also track it by media market as well. In part, that helps us connect the media outlets to what is going on in their areas. So we have a lot of interaction with the media outlets, and also looking at how we can strategically utilize some of our social media and some of those other things, so the traditional and the non-traditional, and breaking it down by media markets also very helpful when you're trying to do some of that targeted media interaction with what is going on, and getting some of those activities covered and drawing attention to those activities that are going to be occurring, so that people know where they can go out for those events to get assistance. Next, please. So this is, this is just an evaluation of numbers that we saw come in for just our macro grant. And because those we're able to track applications, of course, but we don't have applications for the entire state. But during this period, obviously, we see quite a number of applications that are coming in during this time period. And so one of the things that we see is this is where the heightened areas, you're going to get the applications coming in, you're probably going to get a lot more appointments, you're going to be helping people navigate the enrollment process. But you don't often see the fruition of that until after the fact, because as people are starting to work their way through the enrollment process, you start to see those hits coming in. We really start to see those numbers going up in around the October, November period, because of the fact that enrollment is not instantaneous, and people are applying and they're coming in obviously with no wrong door. They're also coming in through marketplace applications and sometimes CHIP applications. Sometimes those are being sent over to to CHIP or Medicaid, vice versa. So once you're working, families sometimes are working their way through that process. You can see sort of a little delay in the results of that work that you're doing over open enrollment. But I would encourage you not to get to discouraged, because that's pretty typical. Next, please. So these are just some examples of what the actual events that go on around the state look like. Some of these events are annual events, some are one-time events. During back to school, we do a lot of immunization fairs, obviously the typical back-to-school bashes. And I would say you're going to find that some events seem like they should be amazing, and it's really important to have a criteria or some methodology for evaluating what are useful events to be at, because especially when we are in a time with very limited resources, both time, staff, you want to make sure that you've got people going out to events where you're really connecting with your target population, and that those are really going to enable you to identify and connect with people that need that enrollment assistance. So it's not enough to be out at events and spend 4 hours sitting out somewhere in the sun, because it's summertime, if you're not going to garner that kind of outcome or results. And so doing it every year is not always useful, so you always want to have some kind of method for evaluating what are effective events to participate in, and then making sure that you're constantly following up with those, and maybe attending those events each year, and those events that you haven't seen be very effective. Find other things to do with your team. Next. The other thing that we incorporate pretty heavily in some of the work that we do is the business outreach piece. And I think that this is something that can be done side by side, particularly at a time when we're focusing on the back to school piece. A lot of these community events, they bring in a lot of other partners. It's a really excellent time to use those events to also connect with the other vendors that are there. And oftentimes, a lot of those vendors can be business partners. And these business partners can establish a partnership that can be fruitful throughout the rest of the year, and enable you to reach consumers or families in different ways you might not be able to reach just by attending community events or even the typical school events. So it broadens your reach a lot. It also may provide opportunities for you to gain some resources. For example, one of the partnerships we currently have is one of the owners of, they own 50-some McDonald's in the Tampa Bay area, and they're going to distribute the Kid Care postcards out to all of their businesses, like about 180,000 postcards they've decided to do. And, you know, Florida Healthy Kids has been gracious enough to print up the postcards and for them. And so we facilitated this partnership that we're all working with to allow us to reach, you know, not only the people that work there, but also the consumers that shop there. Next, please. Some other key pieces of back to school, just want to bring to your attention. I think it's helpful, again, I just want to drive this home. The media engagement piece, really valuable. Free media is really helpful. Writing some op-ed pieces, if you have connections with reporters, reach out and tell them what you're doing. And you will find that they're really much easier to work with. I think not everybody is sort of savvy on how to work with the media. And, you know, once you start reaching out to some of the folks in the media and they know you as a resource, you're going to be their go-to person. And it's really great during the back-to-school time to identify the best spokespersons. We like to do a couple of media outreach events with our enrollment event for back-to-school events, and we'll do like 4 of those that we'll actually coordinate each year, and we will include, you know, maybe some local elected officials, some very highly recognized stakeholders, parents who have their kids enrolled in the program, school representatives, maybe a superintendent, and they've all been really willing to participate, and it helps you get the word out. Also, people pay attention to what they're saying. The media will pick it up. It's a great opportunity to do that. Obviously, attend events, business partnerships, coordinating with your CHIP and Medicaid programs directly. They can turn out sometimes to be really excellent partners. Involving them in your media or your outreach events, really a great idea. Reach out to them, invite them to come down and speak at your events if they're, you know, willing to. That's, I highly recommend that. We work very closely with our Medicaid and CHIP program. And then, you know, again, some other what I call unusual suspects for partners, you know, thinking outside the box and bringing them in. In particular areas, they may have, you know, we have areas of the state where agriculture is like, you know, a main source of income. So we've brought in, you know, stakeholders who represent the agriculture community. So, you know, really being willing to think outside the box is really helpful. Next. And, you know, like I said, it's real important to track what you're doing. As you can see, that's one of the things that we try to do. I believe that the results need to be, the outreach needs to be results driven, and our goal always connected to how we're going to impact actual enrollment. I think using data is a great way to engage partners and showing them what's effective, how their role has been effective, how having them involved has been effective, what happened at your event because they participated in it. And so, you know, always be willing to share those best practices and learn and look for opportunities to replicate some of your effective models. Next. Again, these are just some examples of partnership opportunities you can think of. These are some sample of some of the things that we've used. Next, please. An example of an outreach plan. So, you know, we just thought I'd show you a template of something very simple that you could use in planning, you know, your outreach events and how you would move forward with that and who needs to be involved. Next. Sorry. And that's it.
Thank you very much, Jody. We really appreciate your time today. We will now provide an opportunity for our second poll question of the day. This question is, which groups does your organization engage with for back-to-school outreach? We're going to give you a few minutes here to input your responses. Let's take a look at our results. Great. So we're getting a lot of great feedback today, and we, again, appreciate your input. Thank you for taking the poll. And now we will move on to our third presenter of the day. We have Rebecca Shaw with AASA, the School Administrators Association.
Thank you. Good afternoon, everyone. As mentioned, I work in the Children's Programs Department at AASA, the School Superintendents Association. AASA advocates for equitable access for all students to the highest quality public education and develops and supports school system leaders. The Children's Programs Department is committed to equity and educational opportunities and outcomes, reducing racial disparities, and aiding and assisting those children most in need. We are centered on work that drives systems change and increases educational equity. Two components that are exemplified in the school-based child health outreach and enrollment initiative and subsequent toolkit that I'll be discussing today. Next slide. For some background, AASA is a national organization. Our 13,000 person membership is largely superintendents, but also includes other key administrators. AASA has 7 regions and 49 chartered state affiliates, enabling us to reach every school district in every community in the country. And you can find more information about our state affiliates on our website. The direct link is on this PowerPoint in this webinar. Next slide. AASA, in partnership with the Children's Defense Fund, CDF, has long recognized the importance of high-quality health care to student achievement. Since 2011, we have launched health insurance initiatives in 15 urban, suburban, and rural school districts of all sizes across the country. The districts we worked with were located in California, Georgia, Louisiana, Mississippi, and Texas. We had 2 goals with this work. The first is building capacity so health enrollment is part of a district's infrastructure and becomes routine and sustainable. The second goal is to enroll more eligible students into Medicaid and CHIP. Next slide, please. And during the initiative, we work closely with districts located in Texas and California, 2 states with the largest number of uninsured children in the country. CDF state offices in Texas and California help to provide children and their families with on-the-ground technical assistance they needed, which included guiding them through the health insurance enrollment application process. Next slide. The vision of our work is a country where every child has access to comprehensive, affordable health insurance that's easy to get and easy to keep. In essence, our vision is that all children are healthy. So our strategy is pretty simple. By adding the question, does your child have health insurance on annual school forms, school districts can identify uninsured children and work with their communities to link them to appropriate health care coverage. The strategy of adding the question to your annual school forms makes this information available year after year. It is sustainable and something that is part of your back-to-school enrollment routine. Next slide. And this graphic just shows an example of how school districts can add this question to the school form. Next slide. In August 2016, AASA, in partnership with CDF, released the InsureAllChildren Toolkit at a press event co-hosted by former U.S. Secretary of Education John King, former U.S. Secretary of Health and Human Services Sylvia Burwell, in Washington, D.C. The secretaries were joined by AASA's Executive Director Dan Dominish and CDF's President Marian Wright Edelman for a roundtable discussion highlighting best practices for getting more students enrolled in healthcare. And earlier that year, in January 2016, the former secretaries of the U.S. Departments of Education and Health and Human Services highlighted AASA and CDF's health insurance work as a high-impact opportunity in their Healthy Students Promising Futures Toolkit. One of our districts in California, Mountain View School District, was shared as a model on how to identify eligible children and link those children to proper health insurance coverage. Next slide. The Happy, Healthy, and Ready to Learn Toolkit sets the stage for schools and community agencies to work together to identify and enroll in health insurance through the simple, routine, and cost-effective strategy of asking the question, does your child have health insurance on your annual school forms? The toolkit is downloadable as a PDF and online at www.insureallchildren.org. The online toolkit includes an interactive map and videos with advice from superintendents and other key staff, as well as stories that reinforce the need for schools to be involved and ensure children are happy, healthy, and ready to learn. Beyond adding this question to annual school forms, the toolkit is set up to help schools across the country start and improve school-based programs by sharing lessons learned from the school districts that we worked with. And there's a user's guide when you explore the online toolkit with helpful tips on how to navigate through it. You can also use the toolkit to collaborate and get assistance from peers as you build out and sustain your own school-based health outreach programs. Next slide. The toolkit is broken into 5 main sections that outline the specific steps to implement a successful health insurance initiative. Those steps are building a team, identifying uninsured children, reaching out, enrolling children by engaging partners, and sustaining for the future. Next slide. The toolkit includes a brief 10-question assessment to help schools determine the areas they need to focus on and where they're excelling. Throughout your work on your health enrollment campaign in schools, I suggest you take the assessment again to see where you've made improvements over a course of a few months or over a school year. Next slide. Each section details why we need to do this work, who are the key players, and how to accomplish the task. Next slide. Each section also includes components such as engaging videos, examples of materials used in the districts we worked with, district spotlights focused on lessons learned, templates for action plans and monthly reporting, and social media share buttons to help promote broader awareness and stories. There's also a Share Your Story page where you can share your own stories in your community. Next slide. I'd like to highlight 2 of these stories from our participating districts. The first looks at how a district can positively impact a student when a district invests in their well-being. Martin was an unaccompanied minor from Compton Unified School District in California. Once he enrolled in the district, he was connected with a social worker. The district also provided him with gift cards for food and clothes, helped him get eyeglasses and health insurance. As a result, he was able to receive therapy to address trauma in his life. Martin graduated from high school with honors and was admitted to several universities. He's on the path to lead a happy, fulfilling, healthy life socially, emotionally, and physically. The second story underscores the role and importance of school nurses. Evelyn, a middle school student at Edinburgh Consolidated Independent School District in Texas, had a pre-existing health problem, a heart condition. She couldn't participate in physical activities and would often go to the nurse due to shortness of breath. The nurse urged Evelyn's mom to take her to a heart specialist, but her mom couldn't afford the fees, even with a full-time job. So the school nurse was able to refer Evelyn and her mom to an outreach worker to help them through the health insurance application process. As a result, Evelyn was able to get open heart surgery to replace a faulty valve. And her mother was more involved in her daughter's education and even became an ambassador for school enrollment efforts. Next slide. Within the toolkit sections, you can easily share stories like these by using social media icons for Twitter, LinkedIn, and Facebook. And we also developed a social media guide with CDF, which includes shareable graphics with quotes from school administrators and facts about the importance of Medicaid and CHIP. There's also pre-developed messages and videos that can be used to help increase public awareness, build support, and share these compelling stories of these programs and their positive impact on children. You can also join the conversation on social media using the hashtag InsureAllChildren. And during open enrollment season and back to school season, you can even pair that hashtag with hashtags like Enroll365. Next slide. Thank you. I also just wanted to say I'll be able to send some statistics following up this webinar for open rates for the toolkit since its release in 2016. And if you have any questions, feel free to contact me at rshaw@aasa.org or during the Q&A session at the end of this webinar. Thank you very much.
Thank you so much, Rebecca. We really appreciate you sharing these enrollment stories and all of this background information on behalf of AASA and sharing the mission that your work is doing to ensure coverage for all children. We would now like to share our third and final poll question for the day. If local media has covered your back-to-school activities, what kind of media has covered it? certainly are interested in all coverage that has come through for your particular efforts and your outreach and enrollment strategies. As you prepare your responses, we will soon share all of the different back-to-school resources that are available to you, your partners, grantees, and all organizations. Let's take a look at the results. Great. Thank you so much for your participation. We will be sharing these recapped percentages, of course, after today's webinar as well. I would now like to introduce Laura Cavello, who is also a committed partner to the Connecting Kids to Coverage national campaign, who will be sharing a detailed look at the school-based outreach and enrollment toolkit. Welcome, Laura.
Thanks, Jason. As we heard from our speakers today, there are many great ways to connect with schools in your community to reach families who are eligible for Medicaid and CHIP. In order to help with creating and fostering those partnerships, the campaign has created a school-based outreach and enrollment toolkit as a guide to partnering and working with schools in a variety of ways to help get kids covered through Medicaid and CHIP. I'm going to walk through just a couple key features of the toolkit. If you go to the next slide. This toolkit is a great go-to resource to help you identify and provide tips on connecting with the many potential partners within the school system. So folks who have direct inroads with children and families in your school community and can help provide a bridge to talking about Medicaid and CHIP. This could be anyone from school nurses to administrators, counselors, teachers, and coaches. The toolkit includes tips to help you set your approach to outreach, leverage existing school communications, develop key messages, and also to evaluate progress and report success. Next slide. The toolkit also includes several ready-to-use resources, such as a message guide to help frame your conversations that you're having with parents, and that can be really helpful as you're having conversations with members of the school community as well. It also includes template materials such as newsletter and website copy that can be worked into school communications channels, a press release and media advisory, PSA radio scripts, as well as an outreach calendar that lines up with the school year and can help identify some of those key moments for outreach to families. Next slide. We also know that social media can be a great way to reach parents and families during back to school time when health is top of mind. The toolkit offers some sample social media posts along with social media graphics. You can see some of those examples here on the screen. And you can share these through your organization's own channels or share them with schools to use as fun, eye-catching content to get the attention of parents and to get them thinking about enrollment. Next slide. Just to kind of recap here, we know that planning for back-to-school outreach and enrollment can be a big task, and it can be helpful to create a plan. The school-based toolkit can serve as a resource to help you create your own approach and outline a strategy to do some of the things that you'll see here on the screen. So connect with key partners in your school community, to work with schools to embed enrollment into school activities and to really help form sustainable outreach and enrollment practices. And also to leverage those existing school communications channels like newsletters and school phone systems to share information with families on Medicaid and CHIP. With that, I will pass it over to Jason.
Thank you so much, Laura. We really appreciate the opportunity to go through that toolkit, which you are able to download if you go to go.cms.gov/back2school. We also want to go through a number of additional resources that are available to all of you. No matter what stage you find yourself in the back-to-school planning process, the Connecting Kids to Coverage national campaign has the resources that you need for a successful back-to-school season. Not just the toolkit that Laura just reviewed, but additional opportunities to help you plan out your process and ways that you can utilize these resources that will fully support your efforts. Once you have that basic plan in place, you can use our tip sheets, additional resources available that were also available in past webinars, not just in today's, as ideas for other successful events and activities that can truly build out your outreach and enrollment. If you visit the Back to School Initiative webpage for all things back to school and school-based outreach on the InsureKidsNow.gov site, you will be able to access all of these resources directly through the site. You will find tips and ideas, palm cards and posters that are downloadable and customizable, many social media graphics as well. A few tips for your back to school season as we move forward and you're planning out your process in the weeks and months ahead. We go back to, again, using the communication channels that are available right in your community, from newsletters and websites and phone systems throughout each school district, utilizing the community within each school to get your message out, and certainly leveraging both earn and social media as platforms to share that message. You can use the many templates available on ican.gov to submit and pitch your work to any of these platforms, as well as leverage your own organization's social media channels to share the importance of getting kids covered. A few other tips to share for engaging in summer and back-to-school activities. Certainly with summer approaching, another useful approach to engaging eligible families is to identify upcoming summer and back-to-school activities that are happening right in your community. These activities and events are perfect ways to share information about Medicaid and CHIP and talk with families about enrollment and re-enrollment to ensure that there is no lapse. Make a list of these upcoming events to share your messages and materials with your families and throughout your community. That way you can keep track of what is on the calendar ahead of you. Here are just a few examples of back-to-school information sessions and summer camp registration activities that are available for reference. To further recap all of our outreach resources that are involved in the back-to-school initiative, we have our campaign toolkit. We have a full messaging guide allowing you to truly craft key messages that best fit your community and your audience. A full suite of tips and ideas to pull from and build upon, and many customizable items that you can fit, again, not just your audience, but many languages. We offer a number of our customizable materials in multiple languages, from English, Spanish, Chinese, Korean, Vietnamese, Burmese, Somali, and Arabic. All of these assets are available online at InsureKidsNow.gov. Recapping again the customizable materials that are available to you, here's a look at how you can customize some of these options to really best fit your need, from your program's name, some of your local state-based information, website, phone number, contact information in general, and customizing with your own logos as well. Please know that the process to customize materials could take up to 2 weeks, but if you'd like to request information, we've provided a link here to access that guide. A few outreach and enrollment best practices. From the outreach video library, you can take a look at both that and our webinar archive to see what has worked for others in the past, not just in the framework of back to school, but across other initiatives that IKN and the Connecting Kids to Coverage national campaign deals with. All of our outreach videos and previous webinars are available in the outreach tool library on InsureKidsNow.gov. And you can view also past school-based outreach webinars for more information specific to our discussion around back to school today. The outreach videos are very short, and they really showcase a variety of outreach and enrollment best practices that have been gathered from across the country in many different communities. And you can see what has worked best in these areas and what may work best for you. We provided a lot of great information today, and we certainly want to make sure that you have the opportunity to keep in touch with us at the campaign following today's webinar. You can always follow us on Twitter at IKNGOV, IKNGov, and engage with the campaign on social media. Retweet anything that you see posted, share or tag any messages using the hashtags Enroll365, Enroll365, Kids Enroll, Medicaid, and CHIP, all as hashtags in your posts. We also encourage you to sign up for the e-newsletter campaign notes there is a link here to do so, and it will be shared within the newsletter that is shared after this webinar in the weeks ahead. But Campaign Notes is a great resource to ensure you're staying up to date on all of the initiatives that the Connecting Kids to Coverage campaign is regularly dealing with and the communities that we're servicing. You can always email us as well at connectingkids@cms.hhs.gov. We want to hear your stories as well. We want to hear what's working for you in the back-to-school season. We want to hear best practices of your own and any tried and true information and data that you are able to provide. So please share your stories with us and share your feedback. Again, you can always email us at connectingkids@cms.hhs.gov or engage with us on social media as well to share your information. We'll now get into the question and answer period of our webinar. As there are any questions posed, we will access them within the chat box feature. If you have yet to do so, please do enter your questions now. We'll have the opportunity to pose a few questions here today and gauge responses for our group. Our first question is for Evelyn. Evelyn, how did you get past the excuse that you could be given of, quote, we have to ask corporate, particularly when it comes to engaging these supply stores? What would you say is a good response to that?
Well, with the major chains, absolutely, you do have to reach out to corporate. But we found it really easy when partnering with Walmart and Target and Staples, as they are very community-driven. So when I spoke to managers in those stores, they gave me no problem. We wrote the letter in our letterhead, they submitted it, and within a few days we had a response. So honestly, it wasn't that difficult. I know with big chains you have to go through corporate, but it wasn't difficult at all. You just have to put a letter in writing and put it on letterhead.
Thank you, Evelyn. Our next question is for Jody. Jody, how long does it take to have an application approved once submitted?
Well, it can take, I've gotten people in a week, and depending on the circumstances and how complicated the family's own circumstances are, it could take even up to 8 weeks for somebody to get enrolled. And it's not uncommon.
Thank you very much, Jody. And one more question for Rebecca as well, and really for AASA. We've had a number of our attendees today wonder how they can get in touch with AASA so they can learn more about how they can connect with their local school districts in their counties and states. Rebecca, what would you say is the best way to get in touch with AASA, and what information would you share to use as a resource?
Yeah, so I would suggest that people could contact me, and I could direct you to the best department or best part of our organization for whatever your need is. My contact information is rshaw@aasa.org, or you can call me at 703-875-0739. As a member organization, we do have contact with every superintendent that's a member of ours, so we are able to contact school districts in that way. And we have lots of resources on our website, aasa.org, for health insurance or for whatever topic you're looking for.
Thank you very much, Rebecca. That is all the time we have for responses to questions today. We are capturing the questions that were shared through the webinar platform, and we'll be able to provide responses via email and via the e-newsletter following up in the weeks to come. We do want to thank all of you for joining our webinar today. Special thanks to Evelyn, Jody, Rebecca, and Laura, as well as Amy and the entire CMS and Connecting Kids to Coverage campaign team for sharing your insights, stories, best practices, and truly the stories that make up this campaign and really keep it so personalized in each community. Remember that all of these campaign resources are available for each of you to download directly at any time. And you can always learn more about these resources and about the campaign if you visit InsureKidsNow.gov. Again, a recording of this webinar will be available on our website in about 2 weeks' time. If you missed any of our past webinars, or if you'd like to keep this one for reference, you may visit our webinar archive, where this will soon be housed as well. Again, for all information on the Connecting Kids to Coverage National Campaign, you may visit InsureKidsNow.gov. Thank you, and have a great back-to-school season.